would like to pay my respects to my elders past and present, and elders of different nations. I would like to acknowledge you who are watching this video today and pay my respects to your ancestors and families. May Bunjil, my Creator, surround you and keep you all safe on country. And on behalf of my elders, I say Waminjika, Wurundjeri Balaki Mungundibik, which means you're most welcome to the home of Wurundjeri country. And I wish to welcome you all from the tops of the trees to the roots in the ground, because when you look after the country will look after you.
A welcome to country or acknowledgement communicates to the broader community the cultural heritage of Aboriginal people and helps to promote development of mutual respect and understanding. Country to Aboriginal people means the area we grew up on or belong to, not the whole country of Australia. Australia is made up of 512 language groups. Victoria has over 34 language groups, and Melbourne Health is on the land of the Kulin Nation. The Kulin Nation is made up of 5 tribes: the Bunurong, the Wurundjeri, the Tangarong, the Dja Dja Wurrung and the Wathaurong. Wurundjeri are the traditional owners of Melbourne and surrounding suburbs. The Royal Melbourne Hospital sits here on Wurundjeri land. The purpose of this film is to tell you why we're focusing on Aboriginal health and why Aboriginal health is important. The Royal Melbourne Hospital is committed to patient-centred care, treating people as individuals and understanding their perspective and where they're from. This includes a patient's culture and experiences.
I think certainly for the remote, more traditional communities where they have limited contact with hospitals and community services, then that can be quite frightening or difficult for them to be taken away or transported away from their land and their community to come into a hospital.
I do think anecdotally Aboriginal people have maybe not had the best experience in a hospital system in the past.
Traditionally, hospitals and authority sort of places have been seen of areas where elders, because they're so sick, have actually died in hospitals. So it's considered a place to die and not the place to be.
A lot of our mob are a bit scared to go to hospital sometimes because of the history of it. People in our families have been known to go to a hospital and not come back. People have gone in to have babies and the babies have been taken. We feel like there's a lot of government intervention happens in hospitals, and I think that fear still remains.
Did you know that it's mandatory to ask every patient attending the hospital, are you Aboriginal or Torres Strait Islander? Asking this question has been mandatory since 1993.
And are you of Aboriginal or Torres Strait Islander origin?
Yes, Aboriginal.
Yeah.
When you meet someone, rushing the assessment is not necessarily helpful, because I think people need to feel that they're important and being listened to, and perhaps taking the time to tell the story about themselves.
I think today still there's a lot of anxiety about entering the hospital system because the people still feel like they're stereotyped, that there's automatic assumptions about the way they live their life. And so the stereotypes of Aboriginal people when they go into the health system is that they're going to be alcoholics, that they're going to be drug takers, that anything that's happened to them is because they did something bad.
So why do we as hospital staff need to ask this question, besides it being compulsory?
Australia's multicultural, and it's harder and harder to guess someone's background in everyday life. So unless you actually ask the question, you will never really know.
No matter what background someone has and what culture they come from, everybody has different needs, so staff need to respect that and assess that and communicate accordingly.
Basically, you would do what you do with everybody else. Compassion, not judging people, taking them at face value and doing the job as you know how to do the job. That's what you're there for.
The answer provides information about the health status of all Australians. Knowing what services are needed means better health care for everyone. The only effective way to identify someone as Aboriginal and or Torres Strait Islander is to ask.
So where are you from? My mother's Boomerang from around Melbourne. Harvest the Kilda and it takes in the country. It goes all the way down to Wilson's Prom.
So you cannot assume. The only sure way to find out is to ask. It allows the hospital to flag culturally specific care. And if there is a culturally specific service available to Aboriginal and Torres Strait Islander people in the hospital, for example, an Aboriginal service development worker, then this service can be offered. The Department of Health requires all hospitals to collect data on the Aboriginal and Torres Strait Islander status of every person admitted to a Victorian hospital or attending an emergency department. This is so we can deliver the right care, culturally safe care.
Sometimes we might think as clinicians and as employees of Melbourne Health that we are doing the right thing for the patient, yet the patient has a completely different aspect or a completely different feel for what the reason why they're there or what's going on.
If you're going to ask someone to fill in a form themselves, check to see whether they need help with reading, writing and understanding the form, because some of our mob have literacy problems. Did you know Aboriginal Victorians experience poorer health outcomes than non-Aboriginal Victorians in almost every measure of health? Aboriginal and Torres Strait Islander people continue to experience poor health and lower life expectancy than that of the general community of Australia. Many Indigenous people suffer chronic diseases which are entirely preventable and have virtually been eliminated in the non-Indigenous population. As you can see, the graph shows the life expectancy difference between Aboriginal and Torres Strait Islander Australians and non-Indigenous Australians. For non-Indigenous males, the life expectancy is 75, and for Indigenous males, it is as low as 58 years. For non-Indigenous females, the life expectancy is 82, and for Indigenous females, it can be as low as 65.
Across all facets of health, Aboriginal and Torres Strait Islanders fall well below non-Indigenous or Aboriginal life expectancy. Infant mortality, which is 2 to 3 times higher than non-Aboriginal populations. Cardiovascular disease, diabetes, hypertension, eye care, sexually transmitted diseases, the whole spectrum. Aboriginal health falls below the levels of other Australians.
The figures paint a staggering reality. In summary, our Indigenous men and women die up to between 11 to 17 years earlier than other Australians.
Health means that you can live longer than the 58 years men are supposed to survive to. I'm hitting 70 this year.
I think we need to continue to educate. I think that's the grounding. Education within the risk factors is a major issue, and also reducing the fear of actually seeking help. So if patients feel happier to seek help earlier, we're going to get on top of these issues a lot sooner.
The Aboriginal Service Development Worker plays a key role in the Aboriginal community and hospital system. This role provides supportive contact for Aboriginal and Torres Strait Islander patients, families and Aboriginal community-controlled organisations. This should not be confused with the role of a social worker.
I believe my role is to be there and make our people feel comfortable within the hospital, that someone is looking out for their care, not only while in hospital, but extended family that come down from the bush for rural admissions. Along with that is accommodation to be organised. So the Aboriginal Liaison worker has a vital key role in the hospital when it comes to making our people feel comfortable and that their care is being looked after in a culturally safe manner.
The role of the Aboriginal Service Development Worker is that of a cultural interpreter, consultant and advocate who works alongside other hospital staff to assist and support Aboriginal and Torres Strait Islander patients and community-controlled organisations to effectively use the services that are available. They work in partnership with you to assess, provide, plan and coordinate patient care in a culturally safe and responsive way. They also help to locate services that are available for the Aboriginal and Torres Strait Islander patients that come into your care.
This is the health record diary
Yeah.
It's good because it has all your future appointments, all your details in it. So your Medicare card number, healthcare card number, your next of kin. So if there's ever an emergency, someone can contact your next of kin. It has all your important health summary details for any other diabetes educators or Aboriginal health workers that you do see.
We developed the health record diary because we needed a way to communicate health information accurately from one health professional to the other, and for the patient to feel like and to actually have ownership over that.
It is a responsibility of all Melbourne Health staff to develop positive and productive working relationships and partnerships with all of our patients, including the Aboriginal and Torres Strait Islander community. Their role also involves providing supportive contact to the patients and families. As an Aboriginal person, they have knowledge and community connections that enable them to work with their community and the hospital staff to provide the culturally specific safety and support. However, Aboriginal health is everybody's responsibility, and we all have a part to play.
If you're coming from a country town or even interstate, you really need somebody that's going to be able to help you negotiate this place.
You should contact the Aboriginal Service Development Worker if you are treating a patient who has identified as Aboriginal or Torres Strait Islander. If you need advice or support around Aboriginal or Torres Strait Islander issues. If a patient has asked for the Aboriginal Service Development Worker, they may ask for the Aboriginal Hospital Liaison Officer, or AHLO, which is what the worker is known as in other organisations. And for information about services or Aboriginal and Torres Strait Islander community-controlled organisations or groups.
To us, health is about so much more than simply not being sick. It's about getting a balance between physical, mental, emotional, cultural and spiritual health. Health and healing are interwoven, which means that one can't be separated from the other.
So don't think you have to be an expert. Showing a willingness to be responsive and culturally sensitive to your patients is a great way to start. Aboriginal health is everybody's responsibility, and as hospital staff, we have a large part to play in helping to close the health gap.